Hello everyone, I am Dr. Jyotirmay Hegde, consulting ENT and skull-base surgeon at Manipal Clinics Brookfield and Manipal Hospitals Varthur Road. I'll be talking about allergy and sinusitis. So as we know, sinusitis is a very common thing in our day-to-day life, which we usually experience many times in our lifetime. So sinuses are nothing but air-filled cavities within the nose and the sinuses. They are present in the cheeks, in the forehead, in between the eyes and behind the eyes. So usually the sinus infection is called as sinusitis. So whenever there is inflammation or discharge within the sinuses, it's called as sinusitis. It can be two types, acute sinusitis or chronic sinusitis. Acute sinusitis is usually a short-lasted one, which usually lasts up to 3 weeks. And chronic sinusitis is usually meant for long-standing sinusitis, more than 3 months. Sinusitis usually occurs because of infection. It may be viral, bacterial or fungal. Most of the times it is viral and bacterial in short lasting or acute sinusitis, whereas in chronic sinusitis it may be viral, bacterial or fungal. So other causes which can usually cause sinusitis are dust, allergy, pollution, infectants, etc. So when we see, that is the most common thing which is usually seen in the population. The most common features of sinusitis are nasal discharge, that is mucus or purulent discharge from the nose. It may be yellowish or greenish color discharge from the nose. You may be having nasal blockage. Along with the nasal blockage, there can be facial congestion. So that is the fullness of the face, or there can be headache, which can be both in the cheek, forehead or back of the head. There can be toothache, there can be fever, there can be postnasal drip, wherein there is discharge which comes from the back of the nose into the throat, and can be recurrent throat infection as well, and also features of sleep apnea, that is also called as obstructive sleep apnea or disturbed sleep and snoring. So these are the various features of sinusitis. Consult the nearby ENT physician immediately, and then when you have these features, there will be an examination of your ENT done in the first sitting. Along with that, some additional tests may be required, like blood tests, X-ray of the nose and the paranasal sinuses. And in some cases wherein there is severe mass in the nose or something called as polyps or significant sinusitis, you may also be requested to undergo a CT scan of the nose and the paranasal sinuses. It all depends on the type of sinusitis. If there is a short-lasting or acute episode of sinusitis, we may give steam inhalation, nasal wash, saline nasal wash. Along with that, you may also be required a course of antibiotics. Whereas if it is a long-standing or chronic sinusitis, along with the above mentioned thing for acute sinusitis, you may be also advised to undergo surgery for the sinuses if it is not controlled with the medicines alone. So these features are easily available. All the facilities are available at Manipal Clinic and Manipal Hospitals, wherein we have a minimal endoscopic features which can be done, and it's not like the earlier times wherein you have to go a very invasive procedure. It's like a minimally invasive thing wherein with the endoscopic guided, all the clearance from the sinuses can be done, and it's just an overnight procedure. It can be also done as a daycare procedure wherein all the sinusitis can be easily cleared.